This is Dr. Nancy Kuntz, and I'm here today with my colleague, Melissa Gibbons, a genetic counselor at Colorado Children's Hospital. Melissa, maybe you can review some of the pilots and early newborn screening programs for Duchenne muscular dystrophy and how this is going to lead us to changing our practice in the future.
Thank you, Dr. Kuntz. I think I'd like to start off really quickly just reminding the audience of the purpose of newborn screening, which is to identify life-threatening diseases at birth so that effective treatments can be administered as early as possible. If you've listened to some of our previous episodes, you've heard a lot of focus on the fact that with dystrophinopathy, even though many people may not be recognizing the signs and symptoms, that we are actually seeing changes happen right from birth on. We highlighted that typically before 18 months of age, we're able to already see some muscle damage that may not be able to be repaired by therapies and newborn screening. It's been something that the DMD community has been working on for a really long time, but we've had some success lately that really helped us move this one step closer to a reality. The first was in 2019 when the FDA authorized the first neonatal CK testing that could be used for newborn screening that could actually identify CK levels and screen on the spot. Since then, we have actually had several different pilot and research programs across the country that have looked at the feasibility of screening for CKs on the newborn screen to help us identify individuals that may go on to develop Duchenne muscular dystrophy. Those research projects have occurred through the Early Check Research Project in North Carolina, the Brigham and Women Research Project in Boston, as well as pilot studies in New York, Ohio, and Massachusetts. These studies have proven that we can use CK as a marker for Duchenne muscular dystrophy. And as a result, we are currently under review by the Advisory Committee on Heritable Disorders in the Newborn and Children for addition to be added to the RUSP. The RUSP is the Recommended Uniform Screening Panel, and this is something that is at the federal level that makes recommendations for what the state should screen for. And the majority of states do follow these recommendations. Once it is approved by the RUSP, it is a state decision of whether or not they're able to add Duchenne dystrophy to their state program. And there's lots of factors that come into including the state's process for adding them based on their current laws, the cost to add, the ability to follow up for an abnormal screen, meaning that it's really important that you have somebody that can follow these kids once they're identified. However, states don't actually have to wait for DMD to be added to the RUSP to launch the newborn screening program. And in fact, we already have Ohio, Arizona, New York, and Minnesota have either begun screening or have started legislation that will have them screening in the near future. It's always important to remember that newborn screening is exactly that. It is a screening test. Therefore, there will be false positives and false negatives. And it will be crucial that individuals identified on the newborn screen have appropriate follow-up and diagnostic testing and become specialized neuromuscular providers. So what the general practitioner needs to know about the newborn screen is it available in your state? If not, when is it planning on starting? What is the process? How are these kids identified? How are you as their provider notified? How can you partner with a neuromuscular specialist to make sure appropriate follow-up is happening? What to do with false positives and false negatives. So false positives are kids who may screen positive but not have a genetic cause for dystrophinopathy and may need additional workup. False negatives are also something that occurs with newborn screen, so it's still crucial that providers recognize Duchenne muscular dystrophy based on those earliest symptoms that we've been describing. And then the most important thing that I think is true across the board is, who do you call? If you have a suspicion for somebody with Duchenne muscular dystrophy, or you have a patient identified on the newborn screen, who is your first call to connect them to excellent neuromuscular care in your state? Dr. Kuntz, I know you've had some experience with newborn screening programs as well.
I think you summarized it very well. The important thing is to be connected, to know where you can throw out that lifeline and get some additional information. But even when that happens, the primary care providers play an incredibly important role, both in giving the family perspective on these things, as well as providing all the ongoing regular
Mm-hmm.
standard of care, anticipatory guidance, and health maintenance that these children need, even more than a child without a special diagnosis.